Hello, everyone, and welcome to the CAF America session, Lessons in Disaster Philanthropy, the Voices of Charities Facing COVID-19, Volume 8, which will be presented by Ted Hart, President and CEO of CAF America, President and CEO of CAF Canada, as well as CEO of CAF International, as well as Jesse Kraft, Senior Vice President of External Affairs, CAF America. Just a few housekeeping items. That your microphones are muted and your cameras are off. Note that there will be an opportunity for questions at the end of the presentation, so please use the Q&A function at the bottom of your screen to share your questions, as well as the right-hand side of the Everywhere Plus platform. These sessions are being recorded, and we will share the recordings for the webinar within a few days. I'm also pleased to welcome for our Lessons of Disaster Philanthropy, the Voices of Charities Facing COVID-19, Volume 8, Ted Hart, President and CEO of CAF America, as well as Jesse Kraft, Senior Vice President of External Affairs in CAF Canada. Ted Hart, in addition to being President and CEO of CAF America, is the President of CAF Canada, as well as the CEO of CAF International. Jesse Kraft is the Senior Vice President of External Affairs at CAF America, and these two will be presenting on our most recent webinar and our most recent report about COVID.
And thank you very much, Nick. It's my pleasure to be here with you. As was mentioned, this session is also being streamed as part of CAF International's worldwide symposium on philanthropy. So we welcome all of our CAF America and CAF Canada donor clients, charity partners, and the global audience of CAF's worldwide symposium. CAF America started this Voice of Charities Facing COVID-19 series 19 months ago, and we never imagined the world's charities would still be facing the ravages of this pandemic in November of 2021. Over 5 million people worldwide have already lost their lives to COVID. While many in wealthier countries have access to vaccine, millions refuse to protect themselves or those around them. Refusal to be vaccinated has snatched victory against the virus out of reach for many who have thought the progress was being made. Yesterday, we woke up to the Wall Street Journal reporting, quote, Germany hits record COVID-19 tally as pandemic rebounds across Europe. And last week, they reported, with record high deaths, Moscow and other parts of Russia enter a partial lockdown. While those in less wealthy countries are left to beg for vaccine, which today has resulted in half the nations of Africa reporting populations less than 10% vaccinated. The effects of lockdown and economic downturns have left whole regions devastated. The shrinking number of international tourists arrival determined the loss of 12 million jobs in Africa's travel and tourism sector alone. The poorest continent in the world now reports the number of people living in extreme poverty has increased by 30 million people since 2020. In July, Latin America accounted for 35% of all coronavirus deaths in the world, despite just having 8% of the global population. Since that time, there's been a sharp drop in infection rates, but the devastation of death and economic pressures continues to weigh on communities throughout this region. India's response to the first wave of COVID became a model for others in 2020. India prevented high fatalities and manufactured critical materials such as personal protective equipment and essential drugs in record time and helped supply them all over the world. However, when a more infectious second wave hit India, most populous states, the response was less organized and even caused a temporary state collapse. Today, we gather here as many people are looking forward to the holidays ahead and have visions of large family gatherings once again. The United States has announced the lifting of an 18-month travel ban, and airlines are reporting record bookings for international travel. Now, none of us has a crystal ball of what we have learned about this virus is that it is relentless, particularly for those most vulnerable among us here in the United States and around the world. Many who claim to be experts in disaster philanthropy focus on the high-profile immediate aftermath of the disaster with little thought to the long recovery period after the cameras have moved on. It's even harder to find any one of those experts engaged in serious dialogue, urging funding that could strengthen the charitable infrastructure of a community before a disaster strikes. I guess it's true what they say, that's easier to sell the cure than it is to sell prevention. From the beginning of our survey reporting, our goal has been to provide frontline actionable intelligence our donor clients can use to make informed decisions regarding their philanthropic planning in the months and years ahead. The fault lines around racial equality and inclusion, poverty, hunger, and mental health are just some of the acute issues that are front and center for international philanthropists and those focused domestically as well. Waiting for a disaster to cripple communities is just bad business. This webinar and the report that we are sharing with you is a call to action to change the future by changing how we approach giving now. Build back better is a slogan often heard, but in the case of how we can best meet the challenges ahead, for many communities, incremental change just won't make a difference. Systemic change is needed, and philanthropy has a role to play. Our focus today is providing strategic recommendations useful to our donor clients who want to help, who want their philanthropy to be impactful, and want to help build a more resilient charity infrastructure that can be relied upon to provide critical services now during the continuation of this global pandemic and for disasters, emergencies, and the pandemics of the future. Since the initial reports of a cluster of pneumonia causes of unidentifiable origin in Wuhan, China, in December 2019, the novel coronavirus has caused this disease, has spread throughout the world, igniting the 21st century's deadliest pandemic. Tens of thousands of charities have already been forced to close their doors, and many others cut hours, services, and staff. The story the data has shared in the past has been one of uneven hope by many who have survived even beyond their own expectations, and those still facing a surge of infections that is straining medical support beyond capacity to cope. It has been a story of deep concern for nonprofits under great stress, and many remaining very concerned for their own survival through to what we hope will be the end of this pandemic. Today is a call for resilience philanthropy. A key phrase throughout philanthropy is to measure and ensure impact philanthropy. We cannot agree more. One of the highest forms of impact philanthropy is resilience philanthropy. Today, we urge donors, generous givers, philanthropists, and good people everywhere to ask, how are you building a stronger, more resilient charity when you give to that charity? How are you challenging that charity, not just to take on a project, but to show that they are building to be resilient, to be there when others cannot, to provide the strong social safety net we all know is needed, but somehow it always seems like it's someone else's job to fund it. It is clear, if we want charities we donate to, the charities we support, the charities we care most about to be strong, to be resilient, to survive, we must understand the status quo will not meet this challenge. It is vitally important that we all take an honest look at what is happening to charities in every country and every community around the world. Charities are facing disruption of fundamental core support at an unprecedented rate, even as the world's governments and economies struggle to find a new normal. Communities need the charities you support. Let's provide a new pathway, a new dialogue around resilience philanthropy and how you can now measure success with the lessons learned via disaster philanthropy. Now, joining me today to help me share all this important data, information, and insight is Jessie Kraft, CAF America and CAF Canada's Senior Vice President of External Affairs. Jessie?
Hi, Ted. Thanks so much for having me.
Got a lot to cover here today. We'll go to the next slide. here just to share a few things about CAF America's approach to everything that we do. Just one back, Nick. I just wanted to make note of the 3 R's here, that all of our services and everything that we do at CAF America comes back to us a core principle that we call the 3 R's. As a U.S. public charity, CAF America seeks to provide regulatory compliance, risk management, and reputation protection in all of the interactions that we have. So let's go ahead, Nick, to the next slide. This is our 8th Voice of Charities Facing COVID-19 report. CAF has polled 437 charities in 5 countries. We're focused on 5 countries. This research is the latest in the series that began back in April of 2020. CAF America has aggregated the survey responses, and you'll see each of the reports on the slide here. From this report, that themes the past reports to provide and define lessons for disaster philanthropy. Who should read this report, Jesse? What is the focus here for this report?
Yeah, so this report is a bit different than some of the past reports, and there are a few reasons for that, which we'll get into later. But this report is really important for lessons in philanthropy that donors can learn from the COVID-19 crisis and thinking through their strategy and future grant making, and not just their strategy in the grants that they make themselves and what issue areas they support, but really how to build partnerships with charities and how to build the strength of those charities at the same time. So I think it's and of course really important for the charitable sector as well to help them see the lessons that others have learned throughout this crisis.
And to understand a little bit about what donors are going to be looking for in this new world of resilience philanthropy. Nick, let's go on to the next slide, because Jesse, we published our first Voice of Charities Facing COVID-19 report 19 months ago, and each has focused on providing advice and insight on a global scale. This report, however, focuses our attention on 5 countries. Why?
Yeah, so in the past reports, we've brought in responses from over 100 countries, well over 100 countries in each of the reports. So this is a really different approach for us. We really wanted to focus on, as the waves of COVID-19 are hitting certain countries, as we've heard, Europe is experiencing yet another wave of COVID. What we really wanted to understand was what's happening on the ground with charities in these countries, and what are they learning? How are they being impacted by these waves? And these 5 countries we chose for really specific reasons. One, there's just acute increases in COVID-19 within these countries during different periods of the pandemic. So for example, Russia has seen, as of yesterday in the New York Times, these numbers have been reported that, Russia's seen nearly 250,000 deaths. Argentina has seen nearly 116,000, South Africa 90,000, Brazil 610,000, and India 462,000. These numbers are just absolutely staggering and devastating. And we really wanted to focus on these countries to understand what lessons they're learning from these acute increases. We also have a strong, significant presence of grant making and partners in these countries. So that was really useful in obtaining the amount of responses that we did. And then we know that, charities are facing very serious challenges in these countries. So we wanted to bring in the lessons that they've been learning so that others could benefit from that for future crises or, as we continue through this pandemic.
Let's move on to the next slide. Thank you, Jesse. The next 3 slides provide important demographic and scope information. What does this information tell us, and what should the audience, both the worldwide symposium audience and the CAF America, CAF Canada webinar audience that are coming together here, what are the takeaways here that are most important?
Yeah, so I'll take you through these next slides to just share a bit more about the respondents and then why this demographic information we received about these organizations is relevant to the study. So firstly, as you can see here, the majority of the respondents came from Brazil and India, which is not surprising given the size of these countries and also the volume of charity partners that we have in these respective countries. And I also want to say in this slide that I mean, we have a lot of thanks to give to all of our partners that have assisted us in disseminating this report, including our CAF international offices that are in these countries. So we worked with CAF India, CAF Southern Africa, CAF Russia, and also Aegis in Brazil. And then we also owe a huge thanks to RACI in Argentina, as well as Wings, who all helped us disseminate this report. And Nick, if you could move to the next slide. So here you can see the scope of work of the organizations that were responding. So the little numbers underneath indicate how many organizations work in each of those fields that have responded. And really, as has been the case with other surveys, we really have a strong presence of educational organizations within these survey responses. And actually, interestingly, a small number of healthcare organizations here, which is significant given, you'll see in a few slides forward, you'll see that there's a large number of these organizations that are responding to COVID-19 in some way. But what we do see here is widespread impacts of COVID-19 on these organizations in all responding issue areas. So these are not healthcare organizations responding to COVID-19. These are just a wide breadth of issue areas that are supporting this crisis. If you could go to the next slide. So I think this is also really significant. We also asked for each of the respondents, we asked the size of their organization so we could understand the impacts that these organizations were seeing on their operations based on the size of the organization. So what's significant here is that if you add all these different countries together, nearly 75% of the respondents have under 50 staff members, with almost 25% of them having as few as 1 to 5 staff members. So there's really a great prevalence of small organizations that responded to this survey. And as you'll see later in the data, this is significant because the impacts on long-term resilience of small charities has been much greater. And those are the charities that, of course, need the most support during these times. Next slide.
We can go on to the next slide. Jesse, I just want to focus here. This next portion of the webinar will focus on what charities are telling us, and specifically, a very large percentage of charities responding are responding directly to COVID-19. On this slide and the next, what does this tell us, and what are we hearing from those that are facing COVID-19?
Sorry, I was muted. As you can see here, it's definitely a majority of organizations that have said that they're responding to COVID-19 in some way, whether it's through direct relief, informational or educational campaigns, hygiene initiatives, vaccine programs, or other activities. So again, as I noted earlier, this is noteworthy given that only 22 of the respondents are actually from the health sector. So you can really see how organizations have flexed their strategy and their mission to meet the overarching needs of their beneficiaries. But I think, it also says a lot about, the way that they've been able to attend to their primary missions during this time, which we'll get into a little bit later. And we also asked specifically a separate question that's not represented here in this presentation, but it's in the report. We asked whether organizations were playing a role in supporting vaccination campaigns. And the majority that are supporting these vaccinations was from an educational perspective only. And actually in many countries, there are different requirements on what types of organizations can participate in vaccinations. As an example, in Russia, vaccinations can only be distributed by government entities. So that was also an interesting response that came out of the survey. The next slide. So in this question of, we asked how your organization was how each organization was performing overall. So we asked, are they are they closed? Are they experiencing difficulty? Are they surviving? Which means, that they're able to maintain operations and meet the demand of their beneficiaries, or are they thriving? So they have a healthy financial status to cover their programs and operations. So you can really see a wide range of responses here, but it's important to note that all but 5 of the organizations that responded are still operational, indicating that the survey pool really represents organizations that have largely fared well through the pandemic. And of course, as we've seen in past reports, some have closed earlier on in the pandemic. So that's something to keep in mind here. As the pandemic has carried on, we've really seen this consolidation of the stronger organizations in the respondent pool, and this trend has really carried forward. The other thing to note here is that we found that organizations with 5 and fewer employees are 56.5% more likely to say that they're struggling as a result of the COVID-19 pandemic, as opposed to all of the other larger organizations surveyed. So that's significant to some of the comments that we'll make later on. But it was really impactful to see that so many small organizations are struggling the most. You can go to the next slide.
Yeah, on this next slide, Jesse, the disaster of COVID-19 is mostly most acutely felt where? What are we learning? You just mentioned the disparity and the different levels of employment, and then go on to the next slide after you get a chance to review the information about smaller charities.
Sure. Yeah. So we saw here that large organizations, those with 21 or more employees, are roughly twice as likely to report that they're surviving or thriving than small organizations. And so they really seem to be much more able and prepared to weather the storm. So that's important to keep in mind as we move forward. And in this quote here, which we thought was particularly impactful, one organization in South Africa said, "Donate to smaller and medium-sized NPOs. They are on the ground responding very pragmatically to disasters and are often underfunded. In fact, small nonprofits must compete for funds from the large funders." So this is describing one reason to fund smaller organizations. There are many, and of course there are value in all different sizes of organizations, but it shows some of the struggles that.
But interesting that that South Africa would make note of the fact that there is a disparity here, and drawing attention even to funders to that point. Jesse, we can move on to the next slide. For these charities most acutely affected by COVID, what changes in their fundraising have been witnessed in the survey, and what exactly has changed?
Yeah, so there's a lot that's changed. In this specific question, the first question around fundraising that we asked and what has changed in their fundraising, we asked what their primary communication channels have been during this period of COVID-19 in order to connect with their donors and continue fundraising. And as you can see, the social media and crowdfunding mechanisms, so the yellow and the red bars in this graph, factored heavily in their methods of communication, which makes sense. Social media and crowdfunding being, of course, virtual ways to connect. And then, interestingly, in the comments that accompanied this question, several also pointed to the use of WhatsApp as a fundraising mechanism. So, and it seemed like they were calling that out separately from some of these other items. So that's something for us to keep in mind as we, understand how charities are reaching out to their donors more frequently now and during times of crisis. And if you could go on to the next slide. So the second question that we asked about fundraising was, compared to the first year of the pandemic, what changes have you experienced in your fundraising during the recent COVID-19 surge? And there's a lot to take away from this, but I would say the most important takeaways are, one being that 41% of report that their donors' priority issue areas have changed. So that's the light blue bar on here. So what's the long-term lesson here? And what does this mean for donors when disaster strikes? So their priorities are changing. So there's an opportunity cost of making a disaster grant, and then there's an impact on grantees who would otherwise get the funding that they might support during times that there aren't crises occurring. And that's something to keep in mind as donors, plan for their disaster philanthropy in the future and consider the ongoing needs of their charity partners. One in the survey comments, one of the charities in South Africa said, here's a quote from them: "Many of our donations from trusts and foundations were not able to support us due to their loss of income from investments with respect to COVID-19. Many of our other donors also did not have the financial capacity to assist. We did have donors that gave donations toward COVID-19 PPE, but then could not donate for our existing children's homes and programs." So to me, that quote really brings that to life to show, yes, they were getting donors. They still were capturing the attention of donors, but only for a limited part of their activities. And then they could then not fund their children's homes and programs, which are their primary mission.
Yeah, and Jesse, that takes us back to some of the earlier reports that CAF America has done, specifically, that some donors have fallen into need for services, and that we're seeing sort of a shifting of the capacity for some donors to be active donors, putting the pressure even further on those that can still give.
Yes, and that was widely commented on in the comments as well, that many of the individual donors in particular themselves were suffering and no longer able to contribute as they had in the past. And here also brings another interesting lesson and something to take away from this fact is that charities are forced to flex their messaging and their programs to continue to capture the attention of their donors. So, not only do they need to remain nimble in their operations as the context in which they're operating is changing, but they also have to remain nimble in their, their marketing and communication styles and what, their communications to their donors about their programs. So, it also means that when a disaster strikes, that funding is likely to be diverted to organizations that are responding to that crisis, which leaves, the non-disaster activities with less funding to support their day-to-day and their ongoing needs. This is actually something we were really keenly interested in and aware of during the beginning of the pandemic, as we were worried about this occurring, which is why we were so impressed that even in the height of the pandemic, we had many corporate donors that made the decision to still proceed with their standard annual grant making programs to ensure continuity for their charity partners. So, and that was really important, and across the board, of course, we heard great appreciation from the charities who were immediately concerned that all of that funding would disappear. So we've at least seen some of that continue, but that doesn't always happen. So it's good for donors to keep this in mind if you are a regular donor to any given charity, that you need to continue supporting them during these times of crisis.
And Jesse, at the height of the pandemic, some of the charities that came to mind in that category were many arts organizations that were not front and center to providing service to communities, but were really dependent on donors that may have shifted their giving elsewhere. So some donors looked back and made sure that they were giving to those organizations to keep them afloat during the toughest days of the pandemic. Let's move on to the next slide. Again, looking back, one of the benefits, Jesse, of being at this for 19, 20 months, and now on to our 8th report, which I think safe to say neither one of us thought we'd be here doing an 8th report here, is that we do see trend lines. And when we look back to our 4th COVID-19 report, donors are also making changes. You just mentioned some of that. How does this create new approaches for funding during times of disaster or crisis? And now we're starting to get into some of these lessons that we are seeing a change in responses. And how does that help inform the future?
Yes, so the good news here is that we're really seeing various methods of flexibility from donors in these responses, with only a minority of charities saying that they were offered no flexibility. So that's great news. It was also really nice to see in a lot of the comments that several called out the flexibility that CAF America has provided, which was, really heartwarming to see as I read through those, just as a side note. However, many of the comments also said that, more operational support was needed, and which is, charities are seeing as a form of flexibility from their donors. And in some cases that donors need to do a better job of knowing their partners and their programs to help them understand the needs of the organization, and, to not make assumptions about what the needs of the organization are. So, in many of the past reports, the past 7 reports, we have highlighted the need for unrestricted funding to give a little bit more of that flexibility. And now we're thinking about this, taking that unrestricted funding just a bit further, taking it a step further, that concept, and really thinking about the need for resilience funding. So if we could go to the next slide.
Yeah, Jesse, now we get to the heart of this report. Too often, philanthropy is focused on donors giving and charities receiving, but there's something even more fundamental for all funders to consider now as we move into really suggesting that all funders start putting the focus on impact on resilience philanthropy.
Yeah. So that's really one of the most important themes of this report and some of the past reports. But I would say it came out much more in this report, kind of taking a look at, a year and a half later, and how the current stage compares to the first year of the pandemic. So responses that support this message of, needing to build charity resilience fell into 2 main categories. One is that there was a need for appropriate contingency planning, business continuity, disaster response plans, and things like that. The second is that there's a great need for rainy day funds, so that savings can be deployed in times of need. And unfortunately, this was not available to a large proportion of the charities, and only 54% that were surveyed in volume 6, so 2 reports ago, said that they had any reserves at all. So, we asked 2 open-ended questions at the end of the survey, so just discussion questions, not without statistic or without data collected. The first was, what is your biggest learning from the recent COVID-19 surge that will help you prepare better for future disasters? And the second was, what advice do you have for donors interested in providing support? And to the first question, that of, what is your biggest learning? Many of the open responses stated that their biggest learning was that part of their annual budgeting needs to go towards savings. And as tempting as it may be during a crisis, that they should not spend all of those reserves immediately. It was striking how many charities responded with answers like that, where it really sounded like, as we know, and as we've been talking about, the demand for services was much greater than the income that was arriving, and charities that didn't have savings, or that might have had a small amount of savings, they went ahead and overextended themselves and and spent all of their reserves immediately, which has left them in a more challenging position now, a year and a half or over a year and a half into this pandemic. So that was really striking, and there's a lot to be learned from that. And to the second question, which was, what advice do they have for donors? The most frequent response was that they needed to continue providing operational and resilience support. One charity in India said, and this is a quote from them, "Our donors now have difficulties contributing. The contribution amounts have been reduced, but some of them still contribute. However, though we are surviving the situation, in the future, we really need a sound corpus fund to sustain through any critical situations and to meet the recurring expenses." And really, I would say something that's noteworthy here, and a particular point that donors should take away from this, is that donors are often thinking about resilience in their grant applications. But in many of the donor applications that we see, they're only asking the question in one way. They ask, for example, for a list of the top donors, or they ask how many donors the organization has, because the donor wants to know that the organization is sustainable on their own without those contributions. But if they flip that question and begin asking questions about the size of their reserves, or to then decide to provide a small amount of funding that is designated toward a corpus fund, that type of action would get donors closer to ensuring that they're supporting resilient organizations and contributing to that organization's resilience, which is a really important lesson that we should take from this.
Absolutely. Let's move on to the next slide here. Jesse, there's a lot to unpack here, but the future success of disaster and crisis philanthropy depends on successful navigation of this roadmap. Help us understand how donors can navigate utilizing this roadmap, but also for charities to understand their role in being prepared to partner with donors who want to help.
Yes, so this roadmap is something that we created as a result of our Volume 6 COVID report, which I think is very relevant here and something that we're building on more as we learn more from these surveys. But I would say an additional aspect that's important here is that another important piece of an organization's resilience and their sustainability and strength is, of course, the staff that it employs to work for them. And this really came to life for me in the comments, where there were many that were, mentioning staffing challenges throughout the pandemic. Challenges everywhere from, the need to reduce hours of their staff in order to save money, if their donations had decreased, to some organizations stating that there's been a huge toll on mental health of their employees during this pandemic, as we've all seen play out in different ways in our own lives, who themselves have experienced loss due to COVID-19. One respondent was talking about how she lost her husband during this period, which is, of course, absolutely devastating and challenging for mental health of employees globally. So, in thinking about capacity building and this roadmap to resilience, preparedness, and investing in an organization's sustainability, we also need to consider human resource needs. And I think this factors on this roadmap here. This is part of the leadership category that we have here, and also to some extent the DEI category that's reflected here. But it's an important point as we continue to understand the impacts of COVID-19 and the need to recognize employee stability as an important investment for the sustainability of an organization. So I think that's another key point that came out of this. And I'd like to just briefly share an excellent example of an initiative to build charity resilience that actually has come from a program that's managed by CAF UK, our partner in the UK. So they have a program called the CAF Resilience Fund. And while this is a 5-year project that originally started as an experiment to assist small charities in the UK, the COVID-19 pandemic provided a real life test of this resilience fund and the lessons that they were learning through the program. And there were, in this 5-year program that they've held to date, there are 6 core characteristics of resilience that were evident in the charities that have been most successful in these programs. And I just want to share those characteristics here because I think it's important learning for us to take forward. So one was that the resilient organization had a clearly articulated and widely understood charity mission and purpose. 2, that they have effective leadership from both the board and senior staff. 3, that there's awareness of the external environment in which they operate. 4, that they have networks and partnerships that support the charity's mission and purpose. 5, that finances and operations are fit for purpose. And then finally, that the organization has an ability to capture and communicate their theory of change and charity impact. And I think as we think about, charity resilience and how to begin supporting those types of initiatives, these are really important takeaways that we should think about in those strategies. And CAF has actually just released a report on this initiative that will inform future planning around this important topic. So feel free to check that out as well. If you could go to the next slide.
Jesse, we understand now the roadmap for donors. What are charities doing?
Yeah, so charities are building resilience, but they need more support. So as you can see here, we've asked about their preparedness, their evolution of their preparedness to respond based on experiences from the beginning of the pandemic to now. And a number of organizations have said they've decreased preparedness, some that have stayed the same level, but you see a majority here have increased their preparedness to respond. So of course, we know that charities are flexible, but we can really see that here. The organizations have learned so many lessons this year and have increased their awareness and understanding of, what it is to be sustainable through a period of crisis. There's one quote that from a charity in Brazil that came through, which was, due to challenges of reduction of contributions from companies because of the long duration of the unexpected pandemic, this caused us to shift focus to alternative projects to enable sustainability. So you see some of that that flexibility there and shifting their programs. And as I mentioned a few slides back, many organizations are recognizing the need for better preparedness through business continuity planning, providing staff mental health support, and creating reserve funds. And another lesson was that they should not overextend their finances in the beginning of a crisis, as they need to ensure sustainability throughout.
Jesse, as we know, working with so many wonderful funders, those things that funders value and ask of charities as part of a grant process are the things that end up getting done, right? Because those become the priorities. So, asking charities to provide information on the reserve funds, on their business continuity plan, having these things be in place, just as you might ask about an ethics statement or other very important topics that donors over the years have added to the request during a grant process. Those are the things that we're talking about here in terms of embedding those and sort of changing the path forward to have this trend continue, because the slide really points out that charities really get it, the increased need for preparedness, not sitting back and just waiting for the next disaster, but they need help in getting there.
Yes, I absolutely agree. And, I think I think you're right. The structure of the applications and the way the donors approach their charity partners really gives the charities a lot of cues in terms of what that donor is willing to support and is proud to support. And, I think a good example of this is, and this is really phasing out, but donors asking about the level of overhead funding for many years gave charities the cue that, if you have more than 20% overhead or close to 20%, that you're doing something wrong, right? But that takes everything out of context. It takes, some organizations define overhead in different ways, and it devalues things like resilience funding and putting money into a corpus that prepares them for the future. Mm-hmm. So if donors start to flip that in their applications and show that they value this type of future thinking and investing in the future and investing in sustainability, it will really make a difference in those relationships.
Some charity evaluations, Jesse, still mark as a demerit, if you will, if you have an endowment or you have a big reserve fund, as opposed to seeing that as part of resilience philanthropy moving forward. Let's move on to the next slide, because Jesse, what is the call to action?
Yes. So really this idea of resilience philanthropy is the call to action. So, more resilient grantees are better prepared to help their communities weather the storm, both literally and metaphorically. So, this is challenging for many reasons, but it is an important call to action. Grantees will need support for programs beyond just disaster response. And your funding won't necessarily have an immediate and visible impact. And this can be really challenging for donors. But I think one quote I found really interesting is in response to the question about level of preparedness, One organization in South Africa stated that the level of preparedness is immaterial when there's no funding for financial relief and assistance to the sector. So, I think there are a lot of lessons to be learned here, and preparedness is certainly one piece to this puzzle. But really, this funding for resilience is absolutely important. And if you go to the next,
keep going to the next slide.
Yeah, if you go to the next slide. So I just want to, I know I've read a lot of different quotes during this presentation, but I think it's really important to really illustrate some of what the organizations are saying. And, throughout this COVID-19 report series and the overwhelming donor response and the interest in these reports over this year, it is so clear that everyone understands the value and importance of charity sustainability. They wouldn't be tuning in if they didn't. People are tuning in here because they're concerned about the sustainability of charities and how they've been affected by COVID-19, which, we've seen through this report that this has been most challenging for small organizations that don't have savings or reserves and that don't necessarily have infrastructure for business continuity plans. So as donors build long-term partnerships, it is of absolute and utmost importance that they consider building partnerships with local grassroots organizations, but that they also have a genuine conversation with them about their needs and sustainability, with the aim of building in additional funds for their reserves and thinking in the long term. And these two quotes that I'd like to close with before we move on to questions really demonstrate that need in a thoughtful way. So first is a charity from South Africa who said, donors who provide unrestricted or at least informed allocation is hugely helpful to charities in proactively dealing with crises. While it's amazing to have enough milk and nappies for the babies and the children in our home, it's of no use if we don't have the loving hands to steward these gifts and caring for them. So really focusing on the need to, support those operations, support the staff, support the sustainability of the organization, because it means nothing without it. And the last quote is from a charity in India. They said, in an emergency the world has seen due to the pandemic, unrestricted funding helps us to meet critical emergency needs, which is the need of the hour. When these funds are restricted, we are helpless when help is sought for the most needy. So with that, I will move us to questions.
Yeah, and Jesse, we have a question about the roadmap. So Nick, maybe we could go back a few slides to the roadmap. Here we are. Jesse, the question is that there's 6 areas that are called out on the roadmap to resilience. And can you speak to any sort of prioritization or how donors and charities might look at these component parts?
That's a great question. Yeah, I think this is really where the dynamic of, really building a partnership with the organization comes in, because I think that answer is going to change for every charity partner that you have. Some might have great financial reserves that they could already be employing to invest in these other items, but they're not for a variety of reasons, maybe because they don't know they need to, or that's not been a part of their strategy to focus on their own internal capacity building. Whereas others, might have some strength in these areas, but don't have any financial reserves to sustain them. So, I think I could sit here and give some of my own prioritization to this, but I think that prescription would likely be meaningless without knowing what that charity partner actually needs. So I think that's something that donors and charities should be discussing, so that the funding is going toward what is needed the most out of these categories.
And Jesse, how, as a funder, I mean, CAF America has now, with our donor partners, contributed over $2 billion around the world to 120 countries. So when you look at this and you're talking about this dialogue, how does a funder start that discussion? Are there priority areas that you might start, or to your point, is it specific to where the funder is coming from, where their expertise is at, or what their particular interest is. Again, going back to, how can we provide actionable information about this roadmap to donors?
Yeah, it's an interesting question because, of course, we're sitting here saying donors need to do this and that, but donors themselves often don't have an incredible amount of capacity themselves. We know of $1 million programs that are run on a shoestring in terms of the donors that are actually building those strategies. So I would say ideally they're having these individual conversations with these organizations, but that might not always be possible. So I think part of the action would be to think about the way you're wording your questions in your applications, and perhaps leading with a mission statement for your values as a donor, and part of those values could be that you also want to invest in their resilience, not just in the program at hand. So there are, I think, a few ways that you could communicate that, or help your charity partners understand where your values lie. And I think an application and the perhaps preamble to that application could be an efficient way of doing that as well. But another important mechanism that many of our corporate donors in particular use is working with their employees on the ground, who can have these conversations locally and build the capacity of those donors to have those individual conversations.
Yeah, so you use all the tools that are available to you, right?
Yes.
So think holistically. Nick, if we can go back a couple more slides, because we have a question specifically on this notion of flexibility, not only just during the COVID-19 surge, but the question specifically speaks to the lessons that have been learned and what you are seeing and what our staff is seeing in terms of those lessons that seem to have strong legs going forward.
So what lessons we're seeing in this flexibility?
Yeah, so
Yeah.
We saw this in report number 4, and we reported a lot of the changes that donors were implementing at that time, specifically to COVID-19. But now we're several months after that, and we have some insight here into what seems to be sticking in terms of giving some direct advice to our donor clients on what their peers are doing, or what they might want to be considering as they look to shift towards resilience philanthropy.
Yeah, so I would say one thing here is, we've been talking a lot today about unrestricted funding and supporting and being flexible in your funding. And if you are listening and you're a donor in the United States that's giving internationally, you might be thinking, well, I can't really do that because expenditure responsibility rules and the IRS rules for giving internationally actually prevent me from doing that. Where actually that's, there are ways that we've worked with donors to navigate that so that they could be flexible. We've and one of the primary ways that we've done that through this year is to allow amendments to past grant agreements, which is actually absolutely allowable under expenditure responsibility. The charity just needs to work with us to amend those agreements prior to making those shifts, and that's a very simple process. They just need to tell us how they're shifting those funds, and our donors have been extremely flexible and have appreciated that we're going through that process with their charity partners. So I would say that's an important thing to point out because just giving internationally in some countries, in some cases, precludes the ability to give unrestricted funds, but there are ways to manage that still within the cross-border giving context.
Jesse, we mentioned at the opening that some parts of the world are looking to a new normal, and other parts are now facing yet more crisis related to COVID. We've been asked several times, and just you had mentioned it, and this brought to mind, I just wanted to share this again as sort of a learned lesson is, at a time of crisis, there is sort of a thought that, regulations somehow go away, or you don't need to follow them anymore. Since we're talking about disaster philanthropy here and lessons of disaster philanthropy, is that a real thing? Unfortunately,
no. Yeah, there are some interesting cases where, for example, in China, their foreign NGO laws become a little bit less strict in the case of disaster, and this is actually written into the law. But of course, there are still regulations to navigate regardless. But in the majority of cases, no. The rules don't change, the laws don't change. So we still need to follow the required legal processes in order to make international grants, and we can't flex from that, which is challenging for some charities to hear, who when we reach out to get them to complete some application or something during a time of crisis is a difficult way to navigate those relationships and to support them during their time of need. But it is a fact of cross-border giving, and that's not something that can be changed.
So bring all those things together. So regulations don't change. We've got the lessons specifically from disaster and crisis philanthropy, and this call for resilience philanthropy. Build that bridge for donor clients that are listening today in terms of, a couple of things that you've seen working, because we have so many different donors who are already on this journey right now.
Yeah. So, if you're a donor that's looking to make a significant donation specifically for an endowment or a corpus fund or this resilience funding that we've been talking about, the best legal tool to use in this case is an equivalency determination, if you're talking about giving from the United States, at least, because that does allow completely unrestricted funding, and it doesn't have any time constraints on when those funds are used. So we do have great mechanisms that CAF America and other US donors employ all the time for funding that type of initiative. But even within the confines of expenditure responsibility, which requires specific charitable project descriptions and budgets and things like that, you can build in specific things like salaries or different capacity building costs, so long as you have specificity around the charitable purpose that those things support. So I think if you work with an intermediary, it's good to have that conversation with them. And I know CAF America, we flex between the ER and ED tools in the United States for this very reason, so that we can listen to what our donors want to support, or listen to what our charities are collecting donations for. We have partners on both sides, and then we advise them on the best route in terms of the legal mechanism to get the funding there for that purpose.
Jesse, I think a summary to all of that, and Nick, we can go ahead and go right to the last slide here if you want to go all the way through to the end here as we wrap up, is you've got to know what you're doing, right? So you've got to really have a confidence level in the regulations and the ability to navigate through, because there's nothing normal about this new normal.
Yes, absolutely. There is nothing normal about this, but there are so many lessons to be learned, and a lot of this can be taken into your standard disaster philanthropy as these crises arise. So I think this is a really important report to showcase some of those broader lessons that we've learned.
Terrific. Well, Jesse, thank you for joining today. Thank you to all of our guests who are joining us today on the CAF America webinar, and as we feed into the worldwide symposium on philanthropy. This concludes this webinar. We will be sharing both the video and the slide deck along with the report that was issued today. Thank you for joining us, and Jesse, thank you.
Thank you, Ted. Thank you, everyone.